So this is the Runnymede Medical Practice Workflow Optimisation team, and here's Gemma, who's the team leader, who's kind of supported that. So just to let our patients know what the team does and how you're doing it. So Gemma, what's Workflow Optimisation about?
Okay, so before we had all the letters coming in, they were all going all over to the doctors, every single letter. We're now kind of going through the letters that come in. We're coding the letters that the doctors don't need to see, and the only letters that the doctors are seeing are what they need to see, which is freeing up a lot of their time.
And so how's it working out in the practice? What are the volumes of kind of things that are coming into what are the kinds of things that come into a doctor's practice?
We have out of hours, A&E reports, consultations, everything comes in here.
Yeah.
But every week I do, like a spreadsheet of how we're doing, and we're saving 82% of the doctor's time now starting doing this. So the doctors are seeing, say, 15% of the letters, we're seeing the others and dealing with them.
And what are the ways that you're dealing with that other group of letters?
So we are checking that there's no medication changes, anything like that, but we just code them.
Yes.
So we're coding them on EMIS, so they're all on the patient's records, and everything the doctors need to see when they need to see it is all there. We've done that.
And so what's the advantages of that for the patients that you see?
They've got more time, the doctors have more time to spend with their patients.
Yeah.
That is more important than looking through letters that they don't really need to see, or it can be dealt with by.
And how about the consistency of the information going on to the...
So we're all working together, aren't we? So we know what we need to put on there. We've all done modules on this, so we know what we need to put on. So we all know what needs to go on there and what needs to be seen by a doctor. So we just work through all the letters.
And is that checked in a systematic way in terms of how the work is getting allocated out and how we're doing against the kind of the things that we should be doing in terms of the practice?
Yes.
What's the quality control kind of checks that are in place?
I have to every 2 weeks I have to send a report off to the workflow team, and they come back with telling us how much we're saving. I then meet with Dr. House every Monday, and we go through all the letters that we've workflowed, not all of them because it will take a long time, and he will say that, oh, I should have seen that, that's brilliant, but we haven't had the situation where he said that we should have sent that to the doctors and we haven't, so
that's good.
Yeah, so.
And how are the other two members of the team finding out how things are going? Any kind of comments on what the work that you've been doing? No? You okay? You kind of, and in terms of the hours and the work that you're doing, how are you finding reading all the letters and the reports and kind of going through all of that information? Because to do it is quite time consuming, isn't it?
It's interesting.
Yeah.
It is time, but it's interesting and rewarding.
Yeah, it is.
Well,
yeah.
What's the rewarding part of the?
It's just knowing that I think that we can help free up the spaces of the doctors. That obviously they're here for important jobs, and I think it's just nice to know that we've freed up that time for them to do more important things. And it's good. I mean, Charlotte's a new member of the team, so again she's come in and she's learnt the workflow. Julie behind me is just starting to do, because you have to do modules, you can't just go straight in to do them. There is modules that you need to do, so Julie's just starting to do the modules.
And we've got Jackie as well.
Jackie's done, so there's 3 of us that have done the modules. That's myself, Jackie, Mac and Charlotte have done them, and then I'm going to start on Julie, but we needed to do it kind of slowly really because it was new to all of us.
Great. Well, thank you. Thanks for contributing to patient care at Runnymede.